Bismillahirrahmanirrahim. Dear students, so welcome to my new lecture. So in this lecture we will talk about the antihistaminic agent or antihistaminic drug that is called H1 receptor blockers or H1 receptor antagonists. So the most frequently used agents in the treatment of sneezing and water rhinorrhea associated with allergic rhinitis, that is called first generation antihistamines. And first generations antihistamine that is include diphenhydramine and chlorpheniramine mediate, which is available in the market by a different trade name that is called Aoston and Allergons. Second generation antihistamine that is include loratadine, which is available in the market by different name that is called Allergex and Claristine, Lorex and loratadine. Fexofenadine and pseudoephedrine, which is also available in the market by trade name Tilfast and fexofenadine. So they are useful in treating the symptom of allergic rhinitis, which is caused by the histamine release. Ocular, they are also effective in the treatment of ocular and nasal antihistamine delivery services. They are also available. Antihistaminic H1 receptor blockers, they are different in their ability to cause sedation and their duration of action. So different adverse effects which are reported after the administration of H1 receptor blockers and the form of sedation, which are called first generation. Anticholinergic side effect of the first generations antihistamines and the form of dry eyes, mouth difficulty and urination and defecating or transient and may resolve in 7 to 10 days. And while in some cases constipation, they are also reported in adverse drug reactions. Other agent that is called alpha-adrenergic agonist. So alpha-adrenergic agonist, that is also called nasal decongestant. So these are those drugs which can constrict the dilated arteriole in the nasal mucosa and reduce the airway resistance. There are two types of agent. One is short acting, the second one is long acting nasal decongestants. That is, the short acting as phenylephrine, the longer acting is oxymetazoline, xylometazoline, which is also available in the market by trade name rhinozones or nosacares. Whenever they are administered as an aerosol, so these drugs have a rapid onset of action and show few systemic effect. The alpha-adrenergic agonist nasal formulation should be used no longer than 3 days due to the risk of rebound nasal congestion rhinitis medicamentosa. Never used for the treatment for the long term treatment of allergic rhinitis. Now come toward the corticosteroids for allergic rhinitis. So there are other agents like corticosteroids which are also very effective in the treatment of. They are also very effective in the treatment of allergic rhinitis, maybe in the form of beclomethasones, budesonides, fluticasone and flonazolides and seclisonides, momethasones and triamcinones. Corticosteroids are very effective when administered as a nasal spray. It can cause minimal systemic absorptions. So there are some localized effects. You can see here the nasal irritation, nosebleed, sore throat, candidiasis rare. So these are the localized side effects which are reported after administration of corticosteroids. Patient should be told not to be deeply inhaled while administering these drugs. The treatment of chronic rhinitis may not result in improvement until 1 to 2 weeks after starting therapy. Drug used for allergic rhinitis, that is cromolyn. So cromolyn is intranasal cromolyn may be useful, particularly when administered before contact within allergens 1 to 2 weeks. Due to short duration of actions, cromolyn required multiple daily dosing. The second one is leukotriene receptor blockers or antagonists, which is available in a market by trade name Montelukast, which are indicated for the treatment of both seasonal and perennial allergic rhinitis. The drug used to treat cough, that is codeine. So codeine is the standard treatment for cough suppression. It can decrease the mode of action or mechanism of action of codeine is it can decrease the sensitivity of cough centers and the central nervous system to peripheral stimuli and decrease the mucosal secretions. Cough suppression occurs at lower doses than analgesia. Common side effects which are reported in the form of constipation, dysphoria, fatigue, and addictions. Another agent is dextromethorphan. So dextromethorphan is a synthetic derivative of morphine that suppresses the response of the central cup center. There is no analgesic effect and antitussive doses. Low addictive profile may cause dysphoria at high doses, which may explain its status as the potential drug of abuse. Better side effect profile than codeine. Guanfacines is another agent which is used as expectorant, available as a single ingredient formulation found in combination product with codeine or dextromethorphans. Benzoate or benzoate, unlike the other opioids, so it can suppress the cup reflex through peripheral action. It can anesthetizes the stretch receptors located in the respiratory passage, lungs, and pleura. So there are various side effects which are reported after administration of this agent, which include dizziness, numbness of the tongue, mouth, and throat may be occurs. Thank you so much for watching my lecture. So if you have any question regarding my lecture, so I am available for your services. Thank you.